Hi, I'm Dr. Fred Wilder. I am a board-certified plastic surgeon. One of the questions we get a lot about implants is the difference between saline and silicone gel implants. For 14 years, from 1992 to 2006, the gel implants were not off of the market, they were just difficult to come by. Women had to qualify if they had certain characteristics of their breasts, we could still use them. But by and large, during that time frame, we used saline implants, which worked well in many women, but they do have a higher tendency to be felt, to have rippling and wrinkling, and a lot of women simply didn't like the way that they feel. So since 2006, we have been able to use the gel implants again. The FDA did place some restrictions on these implants in the sense that you can't use them unless you have specific reconstructive needs in any women that are younger than 22 years old. The FDA also recommends getting an MRI starting 3 years after the surgery and every other year thereafter, which is a wonderful test. It's non-invasive, there's no radiation involved, but it's quite expensive, $1,200 to $1,500 typically, and the insurance oftentimes doesn't pay for that because it's to look at a cosmetic device. They also recommend not going bigger than a certain size, and the size that they recommend not exceeding is 350 cc's. Just by way of comparison, 360 cc's is a can of soda. So that's about the volume that they recommend as maximum. There's no magic reason. There are implants that go much bigger than that, and oftentimes we have to use them, but I think the reason that they put that recommendation on there is that we know that bigger implants over time tend to cause bigger problems in terms of stretching, sagging, and so forth. So those are the restrictions. One of the biggest misconceptions that women seem to have is that an implant needs to be replaced every 10 years. That is not at all true. Implants only need to be replaced when there is something about them that the woman doesn't like. Now with time you have to expect that something may change and you may have to replace the implants, but it's because you want to replace them, not because the calendar says that you have to.